When you look at the industry today and you look at different services, different procedures, maybe different products, what are some of the things that you see as opportunities for growth within individual practices?
That is a great question. And I get that all day, every day from partners who say, I want to try X, Y, and Z. Great. Knock yourself out. I think more practices fail trying to do X, Y, Z instead of the bread and butter basics dentistry. I'll give you an example, and I think I'm going to probably piss some people off with this. Maybe not this audience, but sleep. I have seen more people drive their practices into the ground trying to do sleep dentistry and focusing strictly on sleep than just doing fillings and crowns and, the bread and butter stuff. Not saying that's not an important topic. That should be a part of your practice. But I've seen offices that say, I'm not doing anything else. I'm doing a sleep center, and you need a filling on number 3, you're going to have to do a sleep study at home because you're not breathing right. That's just not logical. So that would be an example of something that's done. Frankly, for me, the focus is the basics. I want you to be able to do a really good exam. I want you to be able to really have a great conversation with patients and show them what's going on in their mouth and be able to do comprehensive dentistry. I want you to be able to do a really efficient crown prep. I want you to be able to do root canals and place implants if you like surgery. If you did that and got really, really good at the basics, there's not a lot of outside stuff that you have to really worry about. So frankly, my goal is just to make sure that we reinforce the foundation and the basics. Our partner doctors are pretty good at a lot of that stuff. We do have a lot of young associates that graduate from dental school. And I finished dental school in 97. So I guess I'm coming up on 29 years in the dental profession. The training today is different than it was back then. And even when I was graduating, the training was different than graduating 10, 15 years earlier. You just didn't get as much hands-on with the patients in dental school. So for our associates, if you're joining our organization, we call it the pathway to partnership. We want our associates to have a great time, learn. We have a foundational program that they go through. That's 5 workshops that every associate we want them to go through. That's going to reinforce their basic skills. That's going to make them a better dentist. And eventually, we would love for them to eventually take over from one of our retiring partners. So that's been my focus, not ancillary stuff, but really building the foundation. Now, having said that, we do have some really advanced dentists. So we're doing an ExoCAD course, for example, for about 15 of our doctors, led by one of our clinical directors. They're doing large cases. They're doing full mouth stuff. They're doing all on X, and we can teach them some basic softwares that you can have better patient care and save a tremendous amount on costs by being more efficient with some of that software in-house. That's something I'm happy to invest in.
So you kind of described a suite of skills and procedures that if you can dial those in, you're going to experience growth in your practice. But you also included things like root canal and implants, which many clinicians are not necessarily as comfortable doing. When you think about additional specialty, like more complex ortho cases or things along those lines, how do you handle that? Do you guys mostly refer out? Do you look to have specialty locations that you're thinking about folding into the organization? What's the approach there?